Happy to have you join us today on the program Healthy Living on Independent Television. And today we decided to leave the studio. Of course, we don't have to be in the studio all the time, particularly this period that the University of Benin is doing something marvelous for women out there. You know, they're celebrating their 50th anniversary and they decided that they have to give back to the society. Most women are having some treatment free, so to speak. They're having testing free here, cervical cancer, prostate, breast cancer, you know it. And we know that breast cancer, cervical cancer, one of these are two major reasons why women die, particularly when they do not present on time. No, most men don't know. By the time they know what is happening with their bodies, well, it's already stage 4 thereabout. So today we're here to talk about breast cancer, one of the major cause of death amongst my gender, the female folks in our society today. So we're going to be talking to Dr. Irowa Omorodion. He's a consultant general surgeon here at the University of Benin. So doctor, let me congratulate you first. At least you're here to celebrate 50th anniversary with UVTH.
Yeah,
fantastic. And I also was made to understand that you just came out of surgery.
Yes.
Well, I came out of the theater.
Yes.
Must have been a busy day for you.
Yes, quite busy. You know, our days here are actually quite busy in UBTH. Anytime we come to work, there is something always to do.
That's why it's difficult to have you people in the studio. So here we are. We've come to meet you in your own backyard.
Yes, thank you. Thank you.
All right, doctor, let's look at cancer generally before we go into breast cancer specifically.
Cancer is just the abnormal growth that can affect virtually all parts of the body. You know, it can affect this, the skin, can affect the brain, it can affect the mouth, it can affect the other better organs of the body. Those growth are that they continue to multiply, continue to increase in size and have the potential of spreading to other parts of the body, particularly the vital organs, like particularly the lungs, the liver, and sometimes to other organs like the bones can also be affected. So that is why cancer is by itself is very deadly. So it's just like something that's going to eat and take itself. You know, I normally say that cancer is senseless. It inhabits the host, it kills the host, and dies with the host. You know, in biology, basic biology, there is no form of relationship you can use to describe that. It's not a predator takes and kills and move on. Symbiotic, maybe benefits, mutual benefit, parasites takes from you and not get anything back. So, well, for cancer generally, we cannot really describe it. That's why you call it the malignancy. Okay? It's cancerous. It kills and takes away, and goes with the individual. So that's where what cancer is. So it can affect other parts of the body. But we would, in our age that we find ourselves now, we are actually here. Cancer is not here to live with us. Actually, cancer is not very common in our environment, as you know. During this period of this 50th anniversary celebration, the hospital wanted to give back. So we all felt that, let us look at what is actually we are now experiencing in the hospital and let the people know. Not just knowing that it does exist, let them know so that they can become more conscious and possibly look for ways to see if they can mitigate this problem and not develop it at all. And if they do develop it and notice it early, they can come to the hospital so we can be able to do something to achieve a cure. Because cancer by itself is in the early stages. We can achieve a cure with cancers. Okay, we can achieve a cure with it. Get them early, you get the cure. But if they do come in late, yes, there's still opportunity to treat them. And peradventure, some of them will be in remission. I say I'm using the word remission. That period that they will be disease free and you will not be there. Sometimes when it is in late stages, you can only treat them. You cannot say we can achieve a cure with those kind of diseases.
So early presentation is key.
Early is key. That is what.
Okay, let's be specific now, doctor. Breast cancer is one scourge that is taking the lives of women every day, particularly those that do not know that they have. So talk to us about breast cancer. What is breast cancer? One?
Now, breast cancer is that form of growth that affects the breast. It's more prevalent in women because it's commoner in women, though it can occur in men.
In men, okay.
If you put all together, about 1% of those numbers can occur in men. And if for every 10 women you may have a man likely to have a man can have breast cancer. For currently, breast cancer is the commonest cancer in the world. The commonest cancer in the world. Yes, as at 2020, about 3.2 million people were diagnosed with breast cancer. In that same year, about 695,000 people died globally from breast cancer. In that same year also, we found out about 7.8 million people,
including men.
Yes, they are living with the disease up to 5 years if you count everybody together. So if you look at the number, like for instance 2.3, I mean that's actually the population of coming to some states in Nigeria. So you can imagine that number. So but more importantly is that it's not only that people that die more for cancer are coming from underdeveloped world or low medium income countries, because the reason is obvious. Many of these people in those countries coming very late with the disease, so the disease will actually have a toll on them. And of course, why patients will die from breast cancer is only when they are spread to that part of the body. So metastasis, what they call it, cancer spread to another part of the body. Metastasis, that is the commonest cause of death of people having cancer. If cancer is just there, growth somewhere and it's not moving anywhere, I mean, you can live with it, because it has spread that actually kills the patient more. And those are the group of people we have in our environment for so many other reasons. Poor facilities generally, poor enlightenment, people coming in late, and various form of beliefs that affect them to present late to the hospital. So many people who are living with disease actually are more in the Western world, where they have better treatment modalities, where they are better, where they are more aware about the disease conditions, so they can present early. And even though some will present late, they have the facility to cater for them, and make sure that they live with this disease, and as so long as they can.
But it's not so in, like you said, like let's say third world countries, so to speak.
No, I think the major challenge, like if we domicile, look at us now, for instance, I think the major challenge that we have here, is people coming late, is not ability to treat them. It's
people coming late.
Yes.
So we have everything to treat them in this country.
Yes, we have everything to treat them. People coming in late. As I speak now, I myself as a general surgeon, and some general surgeon, we have patients we have treated 10 years ago. In other words, these patients have lived 10 years after treatment. I mean, that makes a lot of difference. It's just many of their compatriots or other people have died before that and from other diseases. So some 10 years after you have treated them, they are still on. I mean, that makes a lot of difference.
Okay, now let's look at signs and symptoms. How would a woman know that, oh, this is breast cancer, I need to go to the hospital? Like you said, women are very culpable of not wanting to go to the hospital on time because we have this belief that it is not my portion, that kind of a thing. So let's look at the signs and symptoms before we look at the beliefs.
I will start like this. You don't need to wait for pain to move. Okay. Because largely, it's only less than 5% of individuals that have breast cancer will ever have pain at the first complaints.
So it's usually painless.
It's usually painless. That is the most important thing everybody should know. So when there is swelling in the breast, or you feel that the breast is becoming awkward or abnormal, you need to start moving. You don't need to see you have pain. Until I have pain, there is no pain here. But most women who have breast cancer, they may have known that they had the swelling for up to 2 years or so before coming. You just say, well, this is not, I don't have pain there, there's no problem. But when you have a normal swelling in the breast, particularly you need to move. At least go to a healthcare provider who will look at it properly for you. Some may have to investigate it and move on. You can see, I'm not saying that if somebody have pain somewhere, you have headache, you are coughing, you're not. Those ones are actually some of them are late presentation of the disease. Some women, some group of women may have like bloody nipple discharge for the first time.
Okay.
Yeah, the bloody nipple discharge, that may be the only that will draw the attention that there's a problem somewhere. Without blood, the bloody nipple discharge, they can come to the hospital and also investigate them. But those two things, particularly painless swelling in the breast, sometimes, bloody nipple discharge, those are the very early symptoms. Okay, so for those who start having cough, back pain, not being able to walk, it is a sign of spread to very other parts of the body. Otherwise, it's really painless. Some will be very pathetic. Some will come with sore in the breast that refuse to heal. Some even the patient will come with sore dressed in the no way. Some will even have to put an handkerchief over their nostrils because the thing now becoming embarrassing. Some now become indoors before they even come to the hospital. That is way too late to present. So at the first time is that abnormal swelling, something is going wrong. If you don't come to the doctor, can always check it. You can be reassured, there is no problem. If we are worried, we can say, go and do this test, do ultrasound or mammography, that will be able to. But other symptoms, if you say patient have pain, it will not present. Usually painless swelling in the breast.
Okay, so what are the risk factors?
The first of them is that if breast cancer is common in women, that's a risk factor you cannot take away. I mean, being a woman is also a risk factor, but the older one gets, is the more likelihood that we may have breast cancer. But more importantly, it also relates to the woman's menstrual history. You know, women who tend to have start their period very early, young girls very early. Some who have
early as what age?
Some early, some 9, maybe 9, start at 9.
That's a problem.
Yes, no, well, look at how it's become a problem. The early menstrual period flow. Some have late menopause, so they have a period where the breast is exposed to the normal changes that occur cyclically. Those actually become a risk factor. But that by itself, if you have early, but among those early, if a young woman had to start having pregnancies very early, it's also protective. Because during that period that the woman is pregnant, they have the way of protecting the breast from undergoing those changes. Okay. When the woman is pregnant, they no longer having menstrual pain. Mm-hmm. That fullness in the breast that comes from every month is not there. The breast stabilizes. Those pain that you have is no longer there. Those changes is not there because the pregnancy stabilizes it. So the more children the woman have, some of them tend to be protective, more multiple pregnancies, particularly carrying to term. Mm-hmm. And those that we have maybe stop their menses very early, so they're also protective. Then the other individuals who will be taking hormonal medications, but for this particular one are those postmenopausal women that will be taking medications in the hormonal therapy that can also increase the estrogen in the blood, and that will affect the breast and make the breast to be dividing and put them at risk. Okay. Then those that take alcohol consumption, particularly in excessive doses, that's the record. Smoking is a factor. Sometimes some individuals have this in the family. Okay. It's familiar. I mean, when somebody in the family have a cancer or a breast cancer, any other person becomes at risk. But the risk actually become more if you closer you are to the individual. Okay. We normally say first degree relative. That means if you're close, the brother, sister, mother, or if a cousin and a second degree relative, the closer your relationship with that person, the more likely that the individual who is not having it, he has an increased risk of having a disease condition. So that the things largely, sometimes there are dietary habits here and there that can also happen. Some people use so many things, chemicals that you cannot know about, but those ones actually we altogether affect the metabolism and also put the patient at risk of developing malignancy. For breast, the menstrual history, pregnancy is related. Is individuals, if they have family history of those who have cancers, even not the cancer of the breast, if any other person in the family have any type of cancer, put any other person in the family at risk. But I mentioned before, the closer the relationship, the more the risk actually is. But of all these ones, we mentioned all these risk factors. Even when all these are properly taken care of, it can only help to reduce the risk development by only 30%. That means we still have 70% that we cannot really account for. Okay, that means that everybody should be on the alert. That's the key. Everybody should be on the alert. Be on the alert. You will learn the skills, how to check. But one thing is that if you know early, you can do something about it and you can get a cure for it.
All right, how is a woman good? Like sometimes you see on television, on radios, do your check yourself. And most often the time, most of us don't even know how to do that check. Can you describe that check of checking for lumps?
No, I think the basic ones is that there's a skill for doing it.
Yes.
Maybe this program will not have further the point of doing that or demonstrate because we do not have. But more importantly is that standing before the mirror, for instance, and checking the breast and look at the cut of the breast on both sides. You hardly have a sense of mind, okay, this is how my breast look. But lying down and trying to touch the breast in a particular fashion, it can also give you an idea, an imprint of the breast in the woman's brain. So once there's any change, you will get to know. But I think the advantage is that you must do it at a particular point in time, and the time will be regular. So our advice is that between 7 to 10 days after the stop of the menstrual flow, in the best time, it must be the same time. So that if a woman does a breast examination when you have a menstrual flow, it will look lumpy definitely. Those are heaviness, yes, you will feel some changes. So it must be the same time, so that you can regularly do it. If once there's any change, you will now know, there's a problem somewhere, I need to see the doctor. But usually it should be done in such a way that all part of the breast is examined. What we normally advocate is that when you examine the breast continuously in a straight line down, and a singular fashion in motion. But it's better demonstration than just being spoken about. So, but generally that this is a skill that you can be taught and you can do it. Everybody can do it. You don't need a doctor to do that. The only time you will come to the hospital to double check is when you not feel something. There are nurses who are taught, there are doctors who are taught, who knows how to do them. They can help you to examine. They need doctor examines, and they also feel that there is something wrong somewhere. The icing on the cake is to ask you to do a radiological investigation, go and do mammography or do ultrasound, as the case may be.
Okay, does the size of breast contribute to the risk of having breast cancer?
Well, there are some studies that do suggest that maybe the more voluminous the breast is, the may be. But the only chance that it don't really hold true. But the only thing is that because the size of the breast is very big, for instance, detecting breast at it become a little bit difficult. You understand? That is the only thing. Beyond that, it does not put any woman at a risk, aside from those factors. So if a woman have a very big breast, for instance, there is something deep down in the breast, it may not know early, because you cannot feel it easily. Like those that have small breast, when they say something is here, that is the only thing. But having a big breast does not put you at an increased risk at all. The factors I mentioned earlier on is what put the woman at risk.
Okay, let's look at the man now, because you did say that sometimes some men, out of 11 persons, 10, one male will have breast cancer. What are the signs and symptoms a man should look out for? He
just getting the same thing. He's also, if I say, painless, but because the male have breast tissue actually, but it's very redundant. It's just under the nipple of the man, very small. So in other words, if it's a swelling, painless is the problem. Okay, the same way. If you want to maybe touch your nipple area, as if this is stronger than before, you need to check again. Just the same thing. You don't need to wait for pain. You don't need to wait for, those are some of the things you need to. Don't need to wait for any other thing. If you can't feel abnormal, sometimes some people just feel biting pain around the breast, particularly for the male, because the tissue is so small. Pain can come on earlier than what you have in the females. They come to the hospital. You check it yourself. Actually, you must know. But if you feel abnormal about it, let me go and go to the hospital and check it. That way, you check it again. If they check, they are not so sure, the same thing, move on, do X-rays or ultrasound just to confirm. Sure. Yes.
All right, we're doing this for your sake as a woman, because most of us women, we like equal meeting cloth. We like, we just like to enjoy life. The only thing most women don't do is go to the hospital. The only time a woman want to go to the hospital is during emergency. It's just a handful of women who are taking their health very serious. So we're using this medium to appeal to you as a woman. Set a date aside for yourself. Go and run a check on yourself. Breast cancer, cervical cancer, they are enemies to the woman. But if you allow those two, they will dwell with you and then take you out, and then they go out too. All right, so we're doing this for you. All right, doctor, you have said all that. Let's look at the treatment that is available to women with breast cancer.
Sorry, I'm going to flip it out a little bit.
Please flip.
I'm going to flip. I'm going to talk about prevention before talking about treatment.
Okay.
Diseases are better prevented than being treated. I'm going to tell you, even treating any disease condition wears everybody out. Wears the patient out, wears the doctors out. Even those who are following the relatives are worn out with it. So why not prevent it? There will be prevention. I mean, you need to do, first of all, the basic thing a woman can do for the first time for breast is to know how the technique of checking by herself. Then if check by herself, know how to do. Then the other one is that healthcare provider can help you check even without no symptom. Then the other one is to do a yearly, particularly those above 40 years old, you do yearly mammography. Yearly. Just be checking it. Even mammography will detect disease before you can even feel it. Before the mass can even show. That is the advantage. So you don't need you just, something is wrong here. Some women have come to say, I just did the mammography, look at what is wrong. And you say, start treating the patient. That patient is cured of the disease completely. So that is the first.
It's possible to be cured completely.
Yeah, prevention, doing that. Then that is basically on examination end. We start doing some lifetime modifications. We did mention just now, smoking, alcohol intake, those are
bleaching,
very, yes. So you need to go ahead and do modifications. Stop those things at the very early time. You will reduce your risk. Then if, for instance, I have a mother or a sister, if I'm a woman, for instance, that have breast cancer, I need to go and check and find out whether I am at increased risk. You also have the capacity to also check whether you are at increased risk. So in other words, if you now know that you are increased risk, you may develop, they look at what they call risk categorization. You do some tests in the blood to check the gene, to see whether you have some gene that is abnormal that your sibling is carrying. If you carry such, you might say, okay, no problem. Since I'm at increased risk, I cannot wait for me to develop this disease. This is the organ that is going to affect. Let me remove the organ from the way, and that can become better. We know of a popular actress, Angelina Jolie. She had removed her 2 breasts. She had removed her 2 ovaries, only because she's going to do some check that she's at increased risk. Her mother and her auntie have cancer, so she needs to do something about it. So she removed the breast and did the reconstruction of the breast. So she removed her ovaries as well, so that they will not develop ovarian cancer or breast cancer. That's on the level of prevention. So prevention will start from lifestyle modification.
Yes.
Okay. The other one with that, the other prevention levels will be examination and doing mammography. If you got early, you can do that. Prevention, the early prevention have names for them all. Primary prevention, secondary, tertiary prevention. But I'm not going to go into those. I will not get confused with it. The other level of prevention is that, okay, I'm going to be at risk. So why wait for me to develop this disease and start treating? Let me just take out the organs, so that the organ, if the organ is not there, I will not develop this disease. That's the other one. We call it prophylactic mastectomy. I mean, you do it prophylactically, not because there's disease there, because the individual have an increased risk. That is the level of prevention. Then for those who have the disease already, I mentioned that yes, it can be treated. Okay, the first bet is to first of all establish before you treat anything. You need to know, establish it. The patient will complain that they have a swelling here. You need to investigate, doing ultrasound or a mammography. From that, you progress to doing a biopsy, taking a piece of the tissue to the lab to find out whether it's a cancerous or not. Once you made that, beyond just being cancerous, you must also do some other tests on top of the tissue to find out the kind of hormonal, whether the receptor status, what therapy that will be available for you to use for the patient. Only when you're done testing and do some testing in the lab. Then the next step is options of treatment. Will be whether you're going to do surgery primarily. Okay, or you give patients what they call chemotherapies, that are special medications that are designed to burn out cancer cells in the blood. Then the other one is do radiotherapy. These are a local treatment where you can also give radiation treatment to burn out cancer cells in that particular area. Then other hormonal treatment, there are targeted therapies that are available. Whichever you're going to choose, whichever pathway the patient wants to follow, whether you're going to do surgery first or chemo first, will be determined by the stage of the disease that the patient presents with. Patients are coming very early. Most of the early patients will be doing surgery. Surgeries will stem from removing a segment of that breast, and preserving the breast. Sometimes the whole breast will need to go for surgery. Then for chemotherapy, there are other various regimens that are available, drugs that you can combine to give to the patient. Usually, those can span from 6 to 8 months, or usually at 3 to 4 weekly interval for the patient, so you can be able to control the disease. Then remember, this I mentioned just very 3 arms: surgery, chemotherapy, radiotherapy. They must all go together. So you know that patient will choose surgery. I say I don't have.
All 3 goes together.
Yes, they always go together. The only time they will not go together is at the early stage.
That is if the patient presents
early. So you just do surgery, then you go ahead and do radiotherapy. Then 2, at least minimum 2, but the early stage must go together.
Okay,
but if it's a late stage that we see here most of the time, the 3 months go together. Patient must have surgery, must have chemotherapy, must have radiotherapy, and probably on hormonal therapy. But the way a manner the patient goes to those routes of therapy will determine the way the patient presents to the doctor. We will not determine I will do surgery first or I will do chemo first, whichever. But radiotherapy must always be done. Surgery must always be done. So like we mentioned just now, coming from theater, doing a surgery for a patient who had chemotherapy. You are doing surgery now. She will be going for radiotherapy later. Some will do surgery first, then chemo, then radiotherapy.
Well, it has been widely argued that this treatment, the particularly chemo and radiotherapy, usually kills the woman even faster.
Oh, okay. I think most times, maybe some of these things are coming from the fact that people don't understand how the patient came to the hospital. It is possible that patient will come to the hospital very late.
Okay.
Cancer is very difficult to treat. Of a truth, it's very difficult to treat. I'll only give you an example. If, for example, we are here now, maybe we are in our house, you may be relaxing on the veranda, you saw a baby snake or small snake enter into the house. You cannot assume that because the baby snake, you go and sleep. No. You will not enter. Is it not? That's the way.
You have to get rid of it first.
Yeah, that's the way we should look at it all the time. But if a big one enters, it becomes like problem. Some people come in very late. So when they are coming to see the doctor, they already stretched the lung. They cannot breathe properly. In the trying to salvage the patient dies. They will say, "Oh, patient take chemotherapy, patient dies with the chemotherapy." that is the story that we know.
What are the side effects of chemo and radiotherapy?
Chemotherapy generally, it affects the whole body system. You know, chemotherapy, the way it's designed is to affect cancer cells. Cancer cells, as we know, is cells that are dividing rapidly. After the chemo stops, everything goes back to normal. So it may affect the bone, and the bone goes down, the rest of the white cell goes down, the ability body to fight infection becomes mitigated. That's become a big problem for patients. But more importantly is the fact that since we know that this side effect, the healthcare system, the doctor treating you, knows these side effects. So before chemotherapy is given, he prepares the patient. He gives the patient medication to ensure that the patient does not develop side effects. If they do develop side effects, he also gives that the side effect will be reduced to the maximum. And the doctor is also prepared. If that effect does occur, the doctor can also manage them. You can see them. We know there are side effects of chemotherapy, definitely. But the healthcare system is designed. While you are giving those drugs, your eye is looking at the patient, giving prophylaxis, something to give the patient to mitigate it or even eliminate those side effects. Of course, vomiting is a common one. Patients are going to vomit, will not be able to eat, some become weak and tired, but this for a period. When the patient is out of the chemotherapy, the patient gets back and become revitalized again and going to live a normal life.
All right, we used to think that breast cancer is an age thing until we started seeing young girls of 20, 28. You know, what could be the reason? Because like growing up, they say, okay, once you're above 40, you just have to start checking yourself. But when a young girl of, an unmarried one for that matter, of 28, 25, 30, I've seen a 27-year-old girl go down with breast cancer, and then she had to do a mastectomy. The question there is this: can she ever have a child?
Now, breast cancer definitely is still commoner in the older women. Definitely. But we are increasingly seeing younger people across boards coming down with malignancies. No terms of the fact that, you know, the risk factors are becoming more, people are engaged in so many things, particularly with the lifestyle issues. That's what they bringing some down. And sometimes some of these young people that we see out there, they have family history. So it's very key. Family history is very key. Sometimes you start, if you go to the family and try to find out, a lot of people have had cancer in their family. So they may come out at the younger age. Of course, we know we have childhood cancer. If you go to a pediatric ward, you have children who have cancer, babies who have cancer. So they do occur. So, but for some cancers who actually have something to do with age, like breast cancer, but the age is coming down. Lifestyle issues, family issues is also one of the things. Then for, as you said now, if once the patient develop the condition, our aim is to treat the individuals, to manage them as much as possible. Sometimes for women who are young, who are desirous of children, there are things, fertility issues need to be discussed. You let them know that all this may want to give, particularly want to give chemotherapy, which is a systemic that affects the whole body. That's what they call systemic therapy. You need to get a fertility expert into the matter. They may need to store their ovaries, store the ovaries for them, so that they can use them subsequent after treatment. Otherwise,
even when it's not cervical cancer.
Yes, you can store the ovaries. You can just, okay, see this young lady, we want to desire children, can take the ovum and take the ovum, not the ovary per se, take the ovum and store the eggs. Maybe use the eggs and store them quietly. Those infertility experts can do that.
Can that be done here?
Yes, it can be done. It can be done. You store those and keep for the woman. When the woman have done treatment, you can now come back and do assisted reproduction technique. They have to more like somebody like going to do like IVF to ensure that they use their ovum and the rest of them.
Wow, it's been quite exciting talking to you. At least you've educated me and educated some women out there who is still doubting. There are some women who are down with pains, but they would rather go ask friends, what I could do? Should I use a mentholatum? Should I use this? Should I use that? Well, you have heard from Dr. Irowa. Early presentation is key. Once you're above 40, please go do some tests for yourself, go do some examination. And if you're younger and have a family history of cancer, whether whatever cancer, whether breast or cervical, just name it. If you know that there's a family history of cancer, please go and run a test and everything will be good for you. All right, doctor, this is where I say thank you so much for allowing me to invade your office this afternoon to ask some questions. Thank you so much. We do appreciate it.
Thank you very much.
Okay.